I'm now going to teach you a couple of rules that are going to make your life incredibly easier when you're trying to actually do behavior analysis, to analyze behavior. The first rule is as follows. When doing direct treatment in behavior analysis, whether you're a BCBAD, a BCBA, a BCABA, or an RBT, you must always first identify who is doing the behavior of interest. In other words, you answer the question, who is the behavior? Who's the person that we're looking at? This seems like it's incredibly simple, Of course you do that. But you'd be amazed at how many people get confused when you have multiple people involved in the scenario of keeping track on who is the person we're talking about in this scenario, who is the behavior. Keep on that. And the second rule is clearly define exactly what behavior you're talking about. You've identified who is doing the behavior, but what behavior are you talking about? You answer the question, what is the behavior, right? So you always start at the beginning by combining rule number 1 and 2 and asking, who's the behavior and what behavior of that person are we talking about? That will allow you to do an analysis because you're going to be looking at that behavior kind of in isolation in the environment in which it's occurring. And you want to make sure that you start at the point of who's doing the behavior, what behavior are we talking about, and now let's analyze everything around that and determine what's going on here. Our next objective is to talk about the target behavior. What behavior are we talking about? We're going to define it and identify observable and measurable descriptions. As part of that, we're also going to be talking about operational definitions. And we're going to list the 3 criteria that go into making an operational definition and identify examples. The word operational definition sounds a little intimidating. It's not. It will make a lot of sense when you hear it. It's pretty straightforward. A target behavior is the specific behavior you're interested in changing. It's clearly defined, it's observable, and it's measurable. It's the focus of the assessment, focus of the analysis, and the intervention. Now, there are various types of interventions, various types of goals that you have. Of what is the goal of behavior change? What are you trying to do? You could be trying to teach a new behavior. In other words, a person needs to learn a new behavior. You may be trying to strengthen behavior that the learner needs to do better or more often. And by the way, that term learner is kind of another term for the behavior, the person doing the behavior. We sometimes refer to as the learner or the student or the individual. There are various terms that we'll use to refer to that person, but it's the person who is doing the behavior. So we want to strengthen the behavior the learner needs to do better or more often. We want to weaken behavior that the learner does too much, right? Or in the wrong place. Well, we'll talk about the wrong place in a minute. We want to replace behavior the learner should stop doing. So there's stuff the learner does too much. There's stuff that the learner should stop doing. There's other behavior that occurs in the wrong place. And we want to teach the proper stimulus control. For example, it's appropriate for a person to, go to the bathroom to urinate on a toilet. It is not appropriate to urinate on a couch, right? Or out in the middle of the street. The environment has to have some control, so the person does the thing in the wrong place. Finally, we want to firmly establish a behavior and get it to happen in many appropriate places and times. We refer to this as maintenance and generalization. Once we teach a new behavior and we get the person doing the behavior correctly, we then want them to do it fluently, wherever they need to be able to do it, and in a variety of settings. So if you're doing potty training with a little kid, for example, you don't want them just to be able to use the toilet that you did potty training on. You want them to be able to use toilets appropriately everywhere and for the rest of their life, right? It's a behavior you want to maintain and you want to spread to a bunch of new environments.